Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Stephanie Desmond. Today we're highlighting another podcast from the Bloomberg School of Public Health, the Johns Hopkins Malaria Minute Extended, a podcast produced by the school's Malaria Research Institute with host Thomas Locke. In this episode, Thomas Locke speaks to Eric Ochomo from the Kenya Medical Research Institute and Seth Irish from the World Health Organization about the rise of the Anopheles stephensi mosquito in Africa and why it's threatening to redefine malaria on the continent. Together, they discuss why the mosquito is in Africa, what this means for malaria, and, more importantly, what can be done. Let's listen.
Hello and welcome to Malaria Minute Extended, a podcast sharing the human stories behind the world's leading malaria science. Today, a new threat in Africa as a dangerous malaria mosquito species invades the continent.
Produced by the Malaria Research Institute at the Bloomberg School of Public Health. This is the Johns Hopkins Malaria Minute
Extended. Eric Ochomo is an entomologist from Kenya. He's dedicated his career to the study of insects, and late last year got an unexpected call from someone working for the National Museum. They were collecting insects in urban settings in the county of Marsabit and turned to Eric for advice.
They were actually looking for dragonfly larvae and breeding habitats for dragonfly larvae. They breed in water. And they came across mosquitoes that they thought were offline in containers. So they reached out and they're like, we're seeing something strange. Do you guys want to check it out? So that's how we ended up sending a team out to Marsabit. And they went out there, they got some larvae and they were in containers. That is not traditionally how we find offline larvae, especially for the anopheles that we're used to in this area.
The mosquitoes that transmit malaria in Kenya are Anopheline mosquitoes, most commonly Anopheles gambiae and Anopheles funestus. They're widely touted to be some of the most effective transmitters of malaria in Africa. And if you want to find them, they're found in rural settings, in large volumes of water, not small containers in the city. The mosquitoes the National Museum found in Marsabit weren't a native species.
We were able to identify them as Anopheles stephensi.
Anopheles stephensi is not normally found in Africa, but instead in Southeast Asia.
And just to confirm that they were indeed stephensi, some of them were rare to adults, so we were able to identify them using the characteristics of the morphology as stephensi. And then 4 of those samples were also shipped to the CDC in Atlanta, who then confirmed via sequencing that they were indeed stephensi. So from there, we went on and submitted a report to WHO on mission.
This is concerning to Eric. He's head of entomology at the Kenya Medical Research Institute. Part of the Kenyan government, the institute helps develop public health policy across a number of disease areas.
The Kenya Medical Research Institute conducts all manner of research in collaboration with multiple partners. The output of what we do contributes towards surveillance and contributes towards guiding the management of the diseases that affect population in Kenya.
In the global arena, Kenya accounts for around 1% of malaria cases, but in the country's court, the disease remains one of Kenya's top health concerns. In 2021, Kenya reported nearly 4 million malaria cases and over 700 malaria deaths. The discovery of Anopheles stephensi in the country is worrying.
We worry about stephensi for multiple reasons. One, Anopheles stephensi is highly adaptable. Speaking to my colleagues in Ethiopia, they have found stephensi literally everywhere. They will breed anywhere. And number 2, they're very efficient vectors of both Plasmodium falciparum and Plasmodium vivax. In Kenya, our biggest burden has been Plasmodium falciparum. So it means that now we are at risk of transmission of Plasmodium vivax. Number 3, even though they say that Anopheles stephensi has a big preference for cattle, if you think about it moving to urban settings where people don't have animals, humans will be the primary host. And in those cases, with their efficiency in transmission, you could see malaria cases going up.
But this wasn't the first time that Anopheles stevensii has been discovered in Africa. In the past decade, the malaria vector has been found in Djibouti, Ethiopia, Sudan, Somalia, and Nigeria. And in Kenya, if Anopheles stevensii develops a foothold in the cities, the consequence could be severe.
Now, if you think about the urban setting scenario, most of our populations in urban settings, especially those who are born outside of the malaria endemic areas of Kenya, are likely to be naive for malaria. So if they're going to get malaria for the first time, we're expecting to see much more severe infections. We could have increased mortality due to malaria. And then lastly, think about the budget. The envelope that's currently available for malaria, it's fixed. It's a fixed budget. We're not getting additional money. If anything, it's shrinking. So if we have expanding areas where we have transmission of malaria thanks to state fires, then we will be talking about dividing the little resources we currently have for control of malaria in the mostly endemic and epidemic-prone areas to areas that we normally, traditionally did not have malaria.
So, what can be done? Seth Irish is a technical officer at the WHO, responsible for coordinating work into the spread of Anopheles stevensii.
Anopheles stevensii is a good malaria vector. It's actually used in laboratory studies of malaria because it's relatively easy to rear and also a good biological vector of malaria. And one of the interesting things about it in terms of its ecology is that it's able to use kind of smaller bodies or containers of water that other Anopheles mosquitoes don't usually use. We are really trying to make sure that everybody's, first of all, aware of this issue. The WHO put out a vector alert back in 2019 when most people weren't really talking about this issue very much, and has continued to push to get more information.
He looks back to when stevensii was first discovered in Africa, in Djibouti.
It all started in 2012 when Anopheles stevensii was first detected in Djibouti. I think the Djibouti scenario is really the one that we're worried about, where we have almost a 30-fold increase in malaria cases. That's where we're quite concerned. We haven't seen this in so much in other places, although we have an outbreak of malaria in an urban setting in Ethiopia, where they had quite a high number of cases compared to what they normally have.
But what's driving this? How and why is stevensii migrating from where it's native, in Southeast Asia, into Africa?
We live in an increasingly urban and connected world, and so this kind of event is probably going to become more likely rather than less likely, as the time that shipping containers take to get from one side of the world to the other is reduced. Then it makes it easier and easier for mosquitoes to hitch a ride and move to a new suitable area. The strain that they found in Djibouti seems to have a close link to Anopheles stevensii from Pakistan, which might indicate shipping avenues, which would make sense because Djibouti has a very large port, and so that could be one way that it's moving.
So shipping could be one way in which stevensii is entering Africa. But it's spreading. Djibouti is a port city in the Horn of Africa, in the western part of the continent. But in 2020, stevensii was found in Nigeria, toward the east. So what can be done? Seth says the right policy response is not entirely clear.
We don't know the right response. This is something new with potential risks for increasing malaria in urban settings, or potentially taking money away from rural settings where we have the highest burden of malaria. I am worried. I think that this is a change to our situation in terms of malaria epidemiology, and we have to pay really close attention. I think we should do as much as we can to quickly assess the situation, to understand the spread, to understand how it's moving, and just as quickly move to ways of controlling Anopheles stevensii. And this might be something that municipalities start to take some responsibility for this and manage the urban malaria mosquitoes, and the national programs focus on the rural settings, or there may be other configurations of control that work better. But I think we have to at least rush to figuring out what the appropriate response is. That's I think an urgent situation, yeah.
One of the WHO's initiatives is a threat map. Like with COVID maps, it shows you where Anopheles stevensii has been spotted. The native species are in green, the invasive ones in red. But in some places, like Djibouti, stevensii has been there for over a decade, continuing to breed and transmit malaria. After so many years, can we still call it an invasive species?
I think the fact that it's been in Africa for 10 years is quite a number of generations in mosquito lifetimes. So I think we can continue to talk about it as invasive because it's continuing to spread, it seems. But in terms of its presence in the Horn of Africa, it seems that it's now a local vector.
So, Anopheles stevensii, though once a species only found in Southeast Asia, seems to be becoming a local species in some parts of Africa. And with its probable links to shipping and increasing globalization, Eric argues it could get worse because of climate change.
There was a recent letter that was written to a journal, and in it, the authors talked about the effect of climate change on the expanding geographical scale for malaria mosquitoes. They're looking in the context of stevensii. I'm thinking about global warming, thinking about the fact that many of the areas that used to be high altitude and therefore much cooler and not conducive for mosquitoes are now getting conducive for mosquitoes. And you have a mosquito that is so efficient at invading new areas. In a short while, we could be talking about stevensii in the really large urban areas, Nairobi, for example. And if that were to happen, it would be a disaster. If we don't do anything about it now, we will likely going to have a disaster in a few years. Given how quickly climate change is changing our weather patterns, is changing our areas that are receptive to Anopheles mosquitoes, it's potentially going to be sooner rather than later.
Sooner rather than later. Anopheles stevensii could redefine the epidemiology of malaria in Africa, and this worries both Eric and Seth. Rural malaria, as the status quo, could be turned upside down as stevensii gains a foothold in urban settings. The fallout could divert resources away from rural settings, and climate change could further extend stevensii's sphere of influence. But there's a glimmer of hope. Data and surveillance, like the malaria threat map, can help us understand the scale of the problem and hopefully get a handle on it. You've been listening to Malaria Minute Extended, a podcast from the Johns Hopkins Malaria Research Institute. I'm Thomas Locke.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.